Welcome to the Chief of Cybersecurity podcast, where we discuss relevant information surrounding protecting networks, devices, and data from unauthorized access or criminal use from hackers. Also, industry best practices and the cybersecurity workforce. Made possible by CIMAS. Learn more at CIMAS.net. For a list of publications, visit DewayneHart.com.
All right, Rich Casanova here again. Welcome to Season 4 of the Chief of Cybersecurity podcast. Dewayne Hart joining us here in the Global Podcast Studios. And we're going to jump right into this next topic. Last topic, we talked about healthcare and cybersecurity, kind of continue that, but a little bit more emphasis now on this crucial role played by Cybersecurity and Infrastructure Security Agency, also known as the CISA, in safeguarding public healthcare. Before we introduce Dewayne, by the way, he is a speaker, Forbes contributor, he is a content creator on YouTube, obviously the popular host of the Chief of Cybersecurity podcast. You can check out all that and more at DewayneHart.com. So, Dewayne, welcome to this episode.
That's right. Welcome. And I also want the audience to know that I do daily posting on LinkedIn that is dedicated to things like workforce development, and so that individuals can learn how to become cybersecurity professional if they're interested. So I find this episode to be very interesting. Season 4, Episode 4, CISA has healthcare covered. This podcast will tell you why. And I'm going to explain to you why they have you covered. Is because that's CISA's job, is to look over the nation and to help the nation understand cybersecurity, but to be the higher upper chain of the pyramid so that people can understand how to carry cybersecurity out through their organizations. And healthcare is one of the sectors that CISA provides help to as well. But I want to share something here. I've actually had the time to work with a couple of professionals from CISA, and they are top notch when it comes to the cybersecurity workforce. Knowing their work, and I've seen some of the knowledge that they have and learning they all provide. And if you have never ever done any research or really went out to any of the social media outlets and actually did some research on CISA, I would definitely tell you to do it, because you will learn a lot, because there's a lot of information shared and there's a lot of publications, videos, and guides, and some great people that work for CISA, because CISA is the cybersecurity agency of the United States, in case people don't know that.
And it's a branch or a division, actually, of Department of Homeland Security. So, the government, the good news is the government really is taking this seriously, and, is being proactive on these issues, particularly in the healthcare sector, because it covers quite a few other sectors as well, as we mentioned in previous episodes or podcasts, government facilities, IT, transportation systems. But today we're talking about all things healthcare, and the Department of Health and Human Services is also involved in this. So this is big picture kind of stuff. So from either a layman's standpoint or somebody within the industry, what are some applications here, or where's the intersection of us going to the hospital, if you will, or normal healthcare, and with CISA?
Okay, so someone to imagine that there's a critical vulnerability or the critical advisory, because CISA goes and does a lot of research on threat analysis and getting all the intel on how hackers operate and finding out all of these known vulnerabilities and these exploits. Now, when CISA finds that information, they will communicate that to the public. Now, I can let the listeners know that you can go to the CISA webpage and you can subscribe, where you get their subscription and you get daily type of alerts or different type of vulnerabilities that surfaces. Now, one of the things that the healthcare institution can take advantage from these alerts and all the assistance that you can get from CISA is that the research is already done, but it can guide you in a direction to try to mature your cybersecurity program, but also too, let's just say, for instance, if you have a vulnerability on one of your medical devices and you need to see the criticality of that particular vulnerability itself, well, CISA itself has a catalog of all the exploits out there, and it gives you information on these vulnerabilities because they've been tested and proved before. Now, in the world of cybersecurity, there is a meaning that you always have to check your source, right? Because anyone can give you information and tell you that you're vulnerable, and anyone can give you information and tell you that you should go to this webpage and check out these vulnerabilities and check out all this information for cybersecurity. CISA has been vetted, okay, because that's their primary job, is to educate the public. Now, for the healthcare institutions, when you're trying to bring on brand new medical devices, when it comes to information sharing, if it has been a ransomware attack or if it's been any type of negative event that has caused a disruption of your IT services, well, you can take that information that you have and you can call CISA, and CISA will help you out in trying to figure out exactly, the best way to resolve your issue. And also, too, there are some free services that CISA does, too, where they can do some small testing on your enterprise just to see how vulnerable you are, because a lot of institutions do not know how vulnerable they are, right? So CISA can help you out with that as well, too. But also, too, with education. If you are in the healthcare sector and if you're trying to determine, okay, how should I structure my cybersecurity workforce? There is something called the NICE framework that is sponsored under DHS, but CISA also has some management pieces of it as well. But to help you understand how to manage your cybersecurity workforce and to how to build your labor categories and, some of the other things that you need as well. So when you think of CISA, it's an all-inclusive way of trying to address cybersecurity.
Well, speaking of education, very timely, you actually just released a recent article on Forbes and entitled "How Federal Agencies Can Improve Their Operational Resilience Program." And this is where you mentioned about CISA has actually roadmapped a resilience planning by creating cybersecurity or cyber resilience review, another one of these acronyms, CRR. But I like the closing of this, and I like you to speak about this topic in your article. But I like the way you closed by saying, the road ahead is simple: plan and reduce cyber risk. But talk to us about CISA and this CRR cyber resilience review.
Okay, then.
And relative to the healthcare, if you can, as well.
Right. Okay. So if you're in the healthcare industry, the term resilience means a lot to you because it's very critical. Because resilience means that you can sustain cyber stress, or if it's a system that is about ready to fail, well, there's redundancy, and you can keep the system online because of patient care, because the patients are the core. So what this cyber resilience review program does, it helps the where are the practices when it comes to resilience, and also to are they effective? Because the reason you would want to have a review done is because you don't want to wait until a critical issue happens and figure out that your system fails, right? Because we have to be proactive. Now, the other part of looking at a cyber resilience review is that it gives you visibility into your enterprise. And I always like to preach that term, cyber visibility, because I believe that the reason we have problems with IT and systems and also in the healthcare industry is that there's a loss of visibility, because that's the unknown, those blind spots that are in your network, those little issues that are in the crevices that you never think about that would affect your resilience program. But imagine if you had a review done and you see that, wow, we have a misconfiguration in this certain system. And guess what? If, per se, we had to back up this system, we could not do it. And there's over 10,000 patient health records that are going to be affected. So when we look at CISA and we look at healthcare, the difference is that the organization, patient care, health records, and data. But some of the principles of cybersecurity still remains intact, because we cannot remove away from resilience and thinking about availability and your continuous monitoring and making sure that we stay proactive and trying to protect those healthcare systems.
Okay, I got another topic or angle here for you to discuss. Actually, in the last episode, we talked about the intersection of the private sector healthcare as well as really focusing on the VA from the government perspective. But we know the vast majority of the healthcare sectors are privately owned and operated. But also, we need to talk about the collaboration of information between the public and private sectors.
Oh, yeah.
Why that's essential. Yeah.
Well, it's essential because of things like COVID-19. I have to go back and bring that up because between the public and the private sector, healthcare information, pretty much stats and trends have to be shared in a certain manner because that's the only way the medical providers can work together to come up with a solution. So if you imagine that between the public and the private sector, and there was information, concerning the public and their healthcare information, and if they did not share the information, the private medical facilities would not have a lead in trying to diagnose certain issues and to help patients out. Because with this information sharing, it is there to help everyone out. Now, I know for a fact that in the past with cybersecurity, there's been kind of a lapse of trying to share information, between different sectors. And it's because of the lack of trust and saying that, well, it's private data. But you know what?
Right.
Our strict priority in healthcare is to take care of patients. So we still have to keep in mind about sharing and making sure the data is protected. But also, too, that's where balanced security comes to surface, right? Patient care, cybersecurity. Okay. We cannot be too restrictive and we can't be too loose. But at the same time, we have to balance that approach. Now, once we balance the approach, that's when we're able to say, okay, then public and private institutions can share information. And I'm pretty sure that there are things in place like some SLAs, right, which is a service level agreements, in your OLAs, which is operation level agreements as well, too, because you have to have those agreements in place, to make sure that everyone follows the same rules and practice when it comes to sharing data. Even so with vendors, right, because there's certain vendors that may have information as well, too. So when we look at the idea of security, then we actually have to make sure that everybody agrees to the same terms, because our primary focus is patients' health care. So when it comes to CISA and looking at this whole entire scheme as well, too, this is where CISA kind of can guide the public on public health care data and information sharing as well, too, and to shine the light so that if it's a place or an institution that think that sharing data should not be done, then maybe they can get the true answer from CISA and, try to make everybody's life a little bit easier.
Right. You mentioned recently on some topics regarding this premise of this toolkit, consolidating key resources in the public health sector, and about fundamental cybersecurity hygiene steps that organizations or individuals should take. Can you give some examples of that, or what might like from an individual organizational standpoint? Because we've been talking about the government agencies and private hospitals, but a lot of companies, organizations have their own healthcare plans and initiatives, and so and there's transferring of data between those organizations as well, right?
Right. So I would let the audience know that a lot of information and things that CISA does is open to the public, right? Now you may not engage with CISA, but there's information that you can gather through different type of research and articles that are written that to help your organization out. So if you're a private organization, there are things like the known exploited vulnerability catalog where you can go and look at the different vulnerabilities that are out there and see how they affect your enterprise. Because most of these cybersecurity people that have worked in the vulnerability management space know what CVEs are and vulnerabilities, but also too, because private industries have maybe different type of software programs. And, these are like proprietary programs that they use in the healthcare industry. So in essence, they're not industry standard, but at the same time, these applications have to be cybersecurity ready. So you can rely on a lot of information that CISA has just to help you out. Now, as I look at some of the other things that are available, like cyber hygiene services, right? And what cyber hygiene is similar to our own hygiene, right? Because, like we have to practice hygiene every day. But cyber hygiene is practiced in cybersecurity on a daily basis. So if you're a private institution, then you can make use of that as well, because maybe there's something in the cyber hygiene services that would go help you out, because a lot of this information is open for reading too.
Right.
So with private industries, I think that they do share information as well, Rich, but I think that there are certain type of restrictions that they just may have, because, some of them have to abide by national regulations, right? And public regulations and policies, versus, like the public institutions and, the public healthcare institution does. But at the same time, the core is patient care, because we always have to think about patient care and bringing in balance security. When we balance security, we have to look at the risk versus the rewards, and not to be too restrictive in a way that people cannot use IT systems, because in the patient care industry, nurses and the providers have to have equal access to that information. And see, we can't be too loose. Well, we just open the door, right, and just let everybody in. So that brings
filtering and monitoring, this data exchange, and doing it in following best practices. So we're almost out of time once again here. We covered a lot of ground, and on a very specific topic, which is kind of interesting and compelling, because you've covered in your book, as well as a podcast episode, about career opportunities within the cybersecurity industry. And this is a very I wouldn't say niche, but an important and a up and coming with CISA involved, and so potentially a person looking for a career opportunity could really almost focus on this. So maybe any closing thoughts on that or others before we wrap up the show, Dewayne?
Yes. I just like to tell the listeners out there, there is an ample amount of information on the planet when it concerns cybersecurity. If you go to my LinkedIn page, YouTube, podcast, and follow me, I put information out every day. But also, too, I want to bring up some previous podcasts I think that listeners can go back and listen to here. Back in 2023, episode 1, how cyber insurance costs impacts the healthcare industry, is very important, because if these medical devices fail, then the healthcare institution has to absorb the cost, right? So we have to think about that too. And some of the other things I want to bring up as well too is that in my Forbes articles and looking at some of the newer technologies that are coming out, and these technologies are there to help the healthcare industry out, especially with medical devices, but also too, at the same time, to all my listeners out there, you keep in mind that when it comes to cybersecurity and the healthcare industry, patient care is the core.
Paramount, yeah.
Paramount, and it's at the core. And also, too, I want you to know that this month has been very important, because I focus on healthcare, and I have a little secret about what's going to come up for next month in March for all my listeners. Right. It's going to be it's going to be full scale artificial intelligence. So you have to tune in to us, because we are going to take artificial intelligence to the next level.
Well, there's your cliffhanger right there, Dewayne. So we're going to wrap it up at this point. But before we do, you mentioned about podcast episodes on this topic. In your book, in Chapter 9 was a great chapter talking about informational sharing and situational awareness. And speaking of the book, you can get a copy of the Cybersecurity Mindset, authored by none other than Dewayne Hart. That's at DewayneHart.com, where you can check out more episodes of the podcast, board articles, all kinds of great content, and as well as advice. And he's always available to reach Dewayne from the website, talking about career opportunities or speaking engagements. So again, Rich Catzova here on behalf of Dewayne Hart and the Chief of Cybersecurity Podcast that wraps up this episode. And remember to wear your hacker's hat, and we'll see you next time.
All right. Take care, my audience.
You've been listening to the Chief of Cybersecurity Podcast, where we hope you've gained knowledge to improve your cybersecurity mindset. Visit DewayneHart.com to learn more about publications, show notes, and more information on cybersecurity.